Good morning. Thank you for joining. We'll get started shortly on this presentation on new requirements for public pools in unincorporated LA County. We'll just give people a couple more minutes to join. Hey, good morning. Thank you for joining us. We'll get started on the presentation for new requirements for public pools in unincorporated LA County. My name is Elizabeth Rhodes, and I'm with the LA County Department of Public Health Environmental Health Division. And I'm also joined by my colleague Daniel Metcalf, who's with our LA County Department of Public Health Environmental Health Division Recreational Waters Program, who will be also delivering part of this presentation. The next slide. So we're here to discuss new requirements for many pools in unincorporated areas that were adopted by the LA County Board of Supervisors on June 28th of this year. This ordinance is known as Roxie's Swim Safe Ordinance in honor of 6-year-old Roxie Forbes, who died by drowning in LA County and whose parents, Doug and the late Elena, worked so hard to advocate for drowning prevention and were really instrumental in the development of this ordinance. The ordinance will take effect on January 1st of next year, and the Department of Public Health is undertaking a number of activities to prepare pool owners and operators to meet these new requirements, including this presentation. So this presentation is being recorded and will be posted to our Roxie Swim Safe Ordinance webpage. The link to that webpage is on our last slide so that anyone can view this presentation if they were unable to attend. During this presentation, we'll review the background and purpose of Roxie's Swim Safe Ordinance, and then we'll get into the details of the ordinance requirements to provide a clear understanding of how to meet them. And I want to reemphasize that this ordinance only applies to unincorporated areas of the county at this time. We have invited pool owners and operators that are impacted by this ordinance to this training session. So again, this ordinance only applies to unincorporated areas of LA County at this time. We anticipate that we'll have plenty of time to answer questions at the end, I would ask that you please hold your questions until the end of the presentation. We'll take the next slide. This ordinance was developed with a lot of stakeholder and public input. In 2021 and 2022, we convened 3 expert stakeholder meetings to gather input on the proposed ordinance content, implementation, and messaging. We also, in spring 2022, held 4 public meetings widely available to the public, families, and pool operators about the proposed ordinance updates. And during those meetings, we answered questions. Now moving into the ordinance requirements. Next slide. One of the important requirements of Roxie's Swim Safe Ordinance centers on reporting and record keeping. So the reporting and record keeping requirements apply to all public pools in unincorporated areas of LA County. Other requirements that we'll discuss later in the presentation are specific to certain types of pools and swimming areas, but these reporting and record keeping requirements apply to all public pools in unincorporated LA County. And the reporting and record keeping requirements are so that the Department of Public Health can promptly investigate any fatal and non-fatal drowning incidents. And the requirements are that all incidents of near drowning, which required emergency medical treatment and transportation to a health facility, or which resulted in death, must be reported by the swimming pool owner or operator to the Department of Public Health within 24 hours of the incident. We also will require that the pool owner or operator maintain records of these incidents for a minimum of 2 years from the date of the incident. Next slide, please. There are a number of key things that Roxie's Swim Safe Ordinance does in addition to reporting and record keeping. One is that it expands where lifeguard services are required, to include public swimming pools located at or used by children's camps and schools, public swimming pools where a direct fee is charged, public swimming pools with an induced current or wave action, including but not limited to wave pools, swimming pools located at or used by juvenile detention facilities, lazy rivers, water slides, public swimming pools where alcohol is served, and public swimming pools when open or in use. If your pool is not one that is described on this slide, then these lifeguard requirements do not apply to your pool. These lifeguard requirements only apply to public pools and swimming areas that are listed on this slide in unincorporated areas of LA County. Next slide. Next, the ordinance requires that all public pools that are required to have lifeguard services must also develop and implement an aquatic safety plan. We'll discuss each of the elements of the aquatic safety plan more in depth later in the presentation. And again, the requirements for the aquatic safety plan only apply to pools that are required to have lifeguard services as outlined in the previous slide. So broadly, the aquatic safety plan includes a pool area staffing plan, an accredited lifeguard plan, a lifeguard staff plan, an emergency action plan, a biohazard action plan, and an accidental chemical release plan. And shortly in the presentation, more details on each of those will be covered. Next slide, please. Additionally, there are some important new definitions provided in the ordinance. The ordinance defines what an accredited lifeguard means. So an accredited lifeguard under the new ordinance means a person who possesses a current certificate from an American Red Cross or YMCA of the USA lifeguard training program, or has equivalent qualifications. They also have to possess a current American Red Cross standard first aid certificate or equivalent. They have to comply with the requirements of the California Health and Safety Code, section 116028. In addition, for public swimming areas, the lifeguard needs to have experience as an accredited lifeguard for at least 1 swimming season or have 100 hours of advanced open water training or equivalent qualifications. Next slide, please. The ordinance also defines what is meant by accredited lifeguard supervisor and the requirements that an accredited lifeguard supervisor has to meet. An accredited lifeguard supervisor means a person who holds a current American Red Cross Senior Life Saving Certificate or equivalent and a current American Red Cross Standard First Aid Certificate or equivalent. Next slide. The accredited lifeguard supervisor also has to have the ability to monitor lifeguard performance as it relates to lifeguard and facility-specific training, including pre-service assessments. They have to have successful completion of lifeguard supervisor training course, previous experience as a lifeguard of at least 3 months. They need knowledge of strategies to reduce risk and mitigate the health and safety hazards to both patrons and the staff. And they need knowledge of the development and evaluation of the zones of bather surveillance responsibility diagrams that are created for the aquatic venue. And now I'll turn it over to my colleague Daniel Metcalf with Environmental Health's Recreational Waters Program, and he's going to delve into the requirements for the aquatic safety plans.
Good afternoon. My name is Daniel with Los Angeles County Recreational Waters Program. I will be reviewing details for the aquatic safety plan, including each of the 6 plan sections. The next 2 slides will provide a general summary with additional details for each plan section to follow afterwards. As a reminder, an aquatic safety plan and lifeguard services will be required for the following unincorporated area facilities. Public swimming pools located at or used by children's camps and schools, public swimming pools where a direct fee is charged, wave pools, swimming pools located at or used by juvenile detention facilities, lazy rivers, water slides, public swimming pools where alcohol is served, and public swimming areas. An example of a public swimming area would be Santa Fe Recreational Dam, for example. If your facility is not one of those types in the unincorporated areas, then it will not need to meet some of these requirements. So the aquatic safety plan consists of a total of 6 plan sections that we will briefly review today. Detailed sample plan templates have been created for facilities to use and are available through our Recreational Waters website. It's recommended that facilities use these provided templates when creating their aquatic safety plan. It should help a lot. The first plan section is the pool area staffing plan, which designates specific pool staff with various roles and responsibilities, such as staff training, identifying and mitigating health and safety hazards, water quality monitoring, and communicating with pool users and staff during an emergency situation. The pool area staffing plan makes sure there is an individual responsible for each role. The one person may cover multiple roles. The second plan section is the accredited lifeguard plan, which details responsibilities of accredited lifeguards at the facility, as well as expectations of conduct and performance. The third plan section is the lifeguard staffing plan, which involves diagramming zones of surveillance, determining how many lifeguards are required at various pool areas, and managing scheduling to ensure there are enough lifeguards and other staff available. The fourth section is the emergency action plan, which outlines how staff will respond to various emergency situations. This section also includes a log for daily pool records, such as temperature, pH, free chlorine, and other chemical readings. The fifth plan section is the biohazard action plan, which documents how the facility staff will react to a biological contamination incident, such as including decontamination and disinfection procedures for incidents involving fecal material, blood, vomit, drowning, and near drowning incidents. The sixth and final plan section is the accidental chemical release plan, which covers how staff will respond to accidental chemical releases, including concentrated acids and chlorine that are frequently used for maintaining pool water chemistry. A cover sheet for the 6 plan sections within the aquatic safety plan should also be included in the plan. It provides dates for when each aquatic safety plan section, lifeguard certification, and training areas were last reviewed and updated. A template for the aquatic safety plan cover sheet is also available on our website. The next 8 slides will cover requirements for each plan in additional detail. The full sample plan templates will, again, be available on our website. strongly recommend that those are downloaded and used when developing your facilities plan. So the first plan section, the pool area staffing plan, focuses on assigning roles and responsibilities to specific staff members. These individuals will be responsible for ensuring that their particular area of responsibility is being monitored and tasks completed per plan, such as conducting pre-service checks of the facility, monitoring water quality, coordinating training and training records, or communicating with staff, patrons, and other agencies if needed when a health and safety hazard is identified. This plan section is for making sure there are trained people scheduled to conduct these roles and duties. One employee may be assigned to multiple roles, so you don't have to have a single staff for each role just because of staffing limitations. So one employee may be assigned to multiple roles, including other roles and responsibilities from the other plan sections. They do, however, need to be trained to complete all of the roles and actually be able to complete them in a timely manner. So you can't have literally every single role assigned to one person just because it could not be completed along with all their other duties. The next plan section is the accredited lifeguard plan. It covers the various responsibilities and expected conduct of the accredited lifeguards at the facility, including training to maintain accredited lifeguard certification. This plan ensures that the accredited lifeguards at the facility are aware of their expected duties and properly trained to ensure that they are able to respond in case of an emergency. Some of the details and terminology included in this plan, such as zones of bather surveillance, are included in the following plan section, the Lifeguard Staffing Plan. The Lifeguard Staffing Plan is a more administrative level overview that includes properly identifying and diagramming zones of bather surveillance and determining the number of lifeguards needed at various pool areas, along with any other responsibilities for each zone. These areas of surveillance are largely determined by the area a lifeguard can be expected to reach within 20 seconds during an emergency situation. The plan requires the facility to identify the minimum number of lifeguards required for each pool area and to provide a staffing plan to ensure full coverage is provided, including during shift rotations. So scheduling. The next plan section is the Emergency Action Plan. This plan includes a diagram of the facility and a detailed list of various emergencies and the corresponding actions that should be conducted by facility staff. An emergency can include everything from the facility power going out, inclement weather such as thunderstorms, a drowning or near drowning incident, or a fire, lots of different types of emergencies. This includes everything from what emergency telephone numbers to call, how the emergency will be communicated to both other staff members and pool users, tasks of individual staff members, and other things like emergency closure requirements in some situations. The next plan section is the Biohazard Action Plan. This plan goes over the facility response when the pool or other areas of the facility are exposed to various forms of biological contamination, including blood, vomit, or feces. Staff should be properly trained to respond to various situations, including where to locate appropriate PPE and the procedures for removing contaminants and disinfection procedures. When a biological contamination incident occurs in the pool itself, additional sanitizing of the pool water is required by temporary closure of the pool and adjusting of the water chemistry per disinfection procedures, which can vary depending on incident type. Liquid stool or drowning incidents will have stricter requirements than, say, a cut where blood gets into the pool water. Details for these procedures can be found in the instructions for management of fecal, vomit, blood contamination, near drowning, and drowning incident at public pools, which will again be available on our website. It's also required that documentation for these incidents be maintained, and they include a number of data that be collected, such as number of pool users, type of contamination, and water chemistry before and after the incident. The sixth and final plan section is the accidental chemical release plan. Maintaining pool water chemistry requires the use of various dangerous chemicals. Some examples include concentrated muriatic acid and concentrated liquid chlorine, both of which can be extremely hazardous. Safety data sheets should be maintained and staff trained on how to respond to various spill incidents. So this includes pool chemicals, but also any other chemicals that are maintained on site. Just because this is for pool facilities, there will more than likely be some dangerous pool chemicals as well, and will be the focus of this particular plan. For many of the more dangerous chemicals, cleaning up anything other than a minor spill requires the assistance from hazmat. Depending on the chemical, this can be anything as small as an ounce or more. Staff should be trained in how to identify what was spilled and the proper response, including emergency contacts and PPE needed. So if there is a particularly bad incident, your chemicals should be labeled. Staff should be able to figure out what it was so that they can respond appropriately. You don't want an untrained staff cleaning up a dangerous chemical. The larger aquatic safety plan as a whole is required to be completed, updated regularly to reflect facility and staff changes, and available for inspector review upon request. Staff should know where it is physically located on site and be able to provide it to an inspector for review in a timely manner. The requirement for creating an aquatic safety plan and maintaining it on site goes into effect January 1st, 2023, so pretty soon. During the first 3 to 6 months of implementation, inspectors will be focusing on educating pool facility operators to ensure they are in compliance with plan requirements. If an aquatic safety plan is noted to have a deficiency in any area, facilities will have up to 14 days to revise and correct their plan. The aquatic safety plan is required to be reviewed and updated at least annually. This will be documented on the cover page, for which again, a template is provided on our website. This is in addition to any updates that are required for assigned roles and responsibilities in the smaller plan sections due to staffing changes. As previously announced, Public Health will be providing several additional events to raise awareness about the new requirements, educate pool owners and operators about how to implement these requirements, and to assist with any questions you may have. Some of our actions over the next few months include an open house on a virtual Q&A session during which pool owners and operators can drop in to have questions answered as they prepare to meet requirements. These additional sessions will be provided December 20th, December 22nd, and January 4th. You can sign up for these events at our website. Additional Q&A information will also be posted on our website. If anyone has any questions, please feel free to ask them in chat now. If you have any questions afterwards, you can submit questions to the Recreational Waters Program at the following contact information, or check our website for additional information. A few minutes will now be provided for questions to come in. Thank you for attending the presentation, and we look forward to helping you with any questions you may have.
And Daniel, we do have an initial question from Linda, which is, what is the lifeguard staff to patron ratio that needs to be in the plan? This is in addition to the lifeguard zone coverage limitations already mentioned.
If you are a facility that already has lifeguards, This determination is, I believe, made by the accredited lifeguard supervisor and based primarily on the zones of surveillance. So what areas can a accredited lifeguard reach within 20 seconds? And if it's a large pool or if it has multiple pools or pool areas, then more lifeguards are required. And the accredited lifeguard supervisor is the one that's going to be looking at that and making that determination. But again, you can get a rough idea based on the zones of surveillance and how quickly a lifeguard can reach those areas in the 20-second requirement. Okay, reading question. Talking college class situation, can the plan of action be described with different requirements based on activities taking place? So the plan templates we provide give a general idea of what should be included in the plan. Each facility can be different depending on each facility and the type of situations that are in place. Each facility can complete a plan that's unique for their particular facility. Again, most of this is going to be reviewed and documented by facility management along with guidance from the accredited lifeguard supervisor to take into account various safety situations depending on the facility type, and activities taking place. And if you have a varied use facility, maybe you want to separate it out for different situations. As long as you include all of the information that's required, which we have in the sample templates, you can expand it and modify it to fit your specific facility type and what's going on there. To go into it a little further to explain it, I guess it's best to explain that that this plan isn't necessarily to set new exact limits for, say, lifeguard to patron ratios. It's mostly to make sure that all of the information is documented, available for review. All the staff are aware of it, trained, and that there are assigned staff to cover all these responsibilities just to make sure that they are being taken care of, so there aren't any lapses in coverage for various areas. Currently, it's only in the unincorporated area of LA County. It can potentially be adopted by various cities within LA County, but there are none currently. You're welcome.
Thank you for all those great questions, Linda. I think we'll hold it open for a few more minutes just to give people time to think through what they've just heard and put any questions in the chat. We also encourage everyone to visit this website that we have, and let me put the link in the chat. This website has links to the templates, has links to our further information about the ordinance. Also, we'll put into the chat the links to our Q&A sessions. Those will, as Daniel mentioned, those will be coming up on December 20th, December 22nd, and January 4th. So as you're working through your aquatic safety plans or anything else, any other questions that you have, this will be sort of an open house for you to ask questions of our environmental health staff, how to complete those. Linda has a further question, Daniel. Can I tell you that your senior lifeguarding certificate mentioned is not a current Red Cross certificate? Also, you did not mention the California Title 22 requirement. I'm surprised that that is not included.
We can certainly take a look at that and make sure if there were anything that was missed for the documentation that we get that included. So anything that you're noticing when reviewing these, we would certainly appreciate feedback just to make sure we do cover everything. So I'll write that down and make sure to follow up on it and update the plan templates if needed.
Yeah, we always welcome. You can reach out via that that email on the screen, rhealth@ph.lacounty.gov, with any questions or comments. I'll just hold the training open for a few more minutes to see if anybody has further questions as you're thinking about all the information.
And yes, Linda, if you have links or quotes directly, if you can send those to that email, and we'll make sure and follow up on them.
I think and we'll wait one more minute to 10:38 and then we'll close the training session if there are no further questions. Great. Thank you so much to all of you for joining our presentation on requirements for public pools in unincorporated LA County. We encourage you as you're working through meeting the new requirements, if you have any questions, to attend our open houses on December 20th, 22nd, and January 4th. The links to register for those are in the chat. And as always, you're welcome to reach out to us at the email address or phone number on the screen. And we appreciate your participation and thank you for all of your efforts to meet these new requirements, which are so important for drowning prevention. And we hope everyone has a wonderful day. Thanks so much.